Well, the press briefing by the Secretary to the Government of the Federation, Mr. Boss Mustafa, right here on Channels Television. Stay with us.
Include the following. One, furnish Nigerians with authoritative, adequate, and multi-sectoral information on the national response. Two, receive feedback through your comments and questions for further processing and improvement. And three, minimize misinformation through fake news. For these reasons, all relevant ministers, the national coordinator of the PTEF, the DG of the Nigeria Center for Disease Control, and heads of agencies will interface with the press through this platform. For the avoidance of doubt, the joint briefing shall, going forward, be the only official daily briefing by the Presidential Task Force. It will, however, be supplemented by other forms of outreaches, such as media appearances by ministers, social media interface, and telecommunication platforms. In view of the fact that this is the first joint briefing, let me reiterate the following. One, the response strategy of the PTF shall remain focused on testing, detection, contact tracing, containment, slowing down the spread and management of coronavirus. A lot of questions have been asked by the public about testing, and the PTF is always willing to provide relevant information and clarifications. Two, several measures have been put in place by government to address the problems posed by the COVID-19 disease. The PTF has been methodical, learning from the experiences of other nations and adapting solutions that suit our environment. These include measures such as enforcing social distancing, advising on personal hygiene, closure of air, land, and sea borders, banning mass gathering above 50 persons, restricting movements in high-burden areas such as Lagos, Ogun, and Abuja, aggressive contact tracing and isolation of cases, improving medical infrastructure, expanding testing capabilities, and establishing new isolation centers. The PTF remains the strategic decision and coordinating body for the national response on COVID-19. It is important to state that the national response strategy for COVID-19 has been developed and is being constantly reviewed as dictated by developments. In the President's broadcast on Sunday, 29th March 2020, he announced far-reaching measures aimed at containing the spread of the coronavirus. For economic sustainability, Mr. President has today approved the constitution of an Economic Sustainability Committee to be chaired by His Excellency, the Vice President. Similarly, you must have heard that Mr. President has also approved the exemption of the financial services sector from restrictions to allow skeletal operations in the financial system and the money market in order to keep the system in light operations during this period. We do not desire to slow down the economy in any way. Let me use this medium to appeal to all Nigerians through you for full understanding, unity of purpose, and in the interest of humanity, to observe all measures put in place, remain vigilant, and cooperate with the security and other agencies who are toiling day and night to keep us safe and alive. Ladies and gentlemen, I shall now yield the podium to the Honorable Minister of Health to update you on new developments. Other ministers will take their turn according to the nature of the questions you would ask. Thank you, and you're welcome.
Secretary to the Government of the Federation, members of the Presidential Task Force on Response to COVID-19, ladies and gentlemen, as of today, the 30th of March 2020, we have recorded 111 confirmed cases of COVID-19 in Nigeria, of which 68 are in Lagos, 21 in the Federal Capital Territory, 7 in Oyo, 3 in Ogun, 2 in Bauchi, 2 in Edo, 2 in Osun, 2 in Enugu, and 1 each in Benue, Ekiti, Kaduna, and Rivers states. Majority of them are persons who came from overseas, and the others have been traced as close contacts of such returnees. The high number of imported cases in Lagos and Abuja is directly due to their function as country gateways for air travel. Till date, 3 persons have been discharged after successful treatment, but sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts, and also isolate and treat in order to reduce the spread of the infection. The Federal Ministry of Health is working closely with states and the Presidential Task Force on COVID-19 to review response activities and to institute measures to protect the health and well-being of Nigerians, while the NCDC-led Multi-Sectoral Emergency Operations Center continues to coordinate national response activities. The NCDC has expanded its capacity by engaging hundreds of ad hoc staff to support various areas of response, including the call centers, contact tracing, and follow-up of persons of interest. On the order of His Excellency the President, all retired but essential and able-bodied staff are to be recalled to service at this crucial period. In addition, training is being conducted for medical personnel to support overall preparedness and response activities to prevent the virus from spreading further into other states. We have identified about 1,000 beds in Abuja that can be put to use immediately as isolation centers if the need arises. Capacity to increase bed space is present. President Muhammad Buhari has approved resources for procurement of required commodities. We're also working hard to open up as many testing sites as possible, and with new additions to the case definition, persons with fever and either cough, difficulty in breathing, or shortness of breath who are in areas of high COVID-19 prevalence can test for the disease. The NCDC has added a new laboratory to its network of molecular diagnostic laboratories for COVID-19 at the University College Hospital, Ibadan. Within 3 weeks, 7 more laboratories will be added in Abakaliki, Kaduna, Kano, Maiduguri, Port Harcourt, and Sokoto to further expand testing capacity nationwide. Members of the public are to note that testing is free of charge, is at no cost to the public. Anyone demanding to be paid or to be given a tip should be immediately reported to the appropriate authorities. Unless you have been tested in one of these 6 laboratories, your results are most likely not valid. If you think you fit the case definition of a suspect case, please call NCDC or your state hotline for immediate testing as the only way to ensure you get suitable treatment. As the situation evolves, we shall need to focus our resources on persons who actually need the test most critically, from the testing time to treatment. I wish to remind citizens of the importance of following the recommended protocol to request testing so as to prevent further exposure and spread of the virus by those who are infected with COVID-19 and who are not able to test. During his address to Nigerians yesterday, His Excellency the President announced the lockdown of non-essential activities in Lagos State, which is the epicenter of the COVID-19 outbreak, the FCT, which has the 2nd highest number of cases, and Ogun State and Oyo State, given their proximity to Lagos. This is effective from 11 p.m. today, 30th of March 2020, for an initial period of 14 days. In the absence of a vaccine, preventable measures such as social gathering have proven to be highly effective in curbing the spread of the disease in other parts of the world. It is therefore one of our major containment strategies in Nigeria. Directives have been issued at national and state level to cancel all large gatherings, including religious, social, and political congregations, and also to shut down schools and event centers. While train stations, land borders, and international airports remain closed, precautionary measures are also being taken by the federal government to protect our seaports. Only ships that have been at sea for more than 14 days can dock in our ports after the crew members have been confirmed to be healthy and negative for COVID-19. An exception to the 14-day restriction on vessels applies only to those carrying oil or gas products, where the human interface between the crew of those ships and the shore is absent or insignificant. These measures may cause inconveniences, but I urge all citizens to accept and practice them in good faith, as they are necessary for our common good and in the interest of all of us. The earlier we collectively take responsibility, the sooner we can go back to living our normal lives. The federal government has announced means of mitigating the effects of these lockdowns, including provision of relief materials and other financial policies. Importantly, this fight against COVID-19 is not for the government alone, but for all of us. With a few simple steps, you can take responsibility and also join the collective effort against the disease. And as always, I will mention them here again. Frequently wash your hands with soap and running water for at least 20 or 30 seconds, or use alcohol-based hand sanitizer. Maintain a social distance of at least 6 feet between yourself and other people, especially those who are coughing or sneezing. Self-isolate for 14 days if you have just returned to the country, in line with the 40-day law. If during self-isolation you develop symptoms like cough, fever, shortness of breath, difficulty in breathing, call the NCDC Connect Center immediately. It is 080097000010, or call 112, which has been linked to the number I just read. Also, stay at home. If you are ill or unwell, stay from others. Clean all frequently touched surfaces with disinfectants at least once daily. Avoid crowds and large gatherings. Cough or sneeze into a tissue. Cover your nose and mouth and if you do not have a tissue, cough into your sleeve. Dispose of any used tissue and wash your hands immediately. Get information only from official sources through the Federal Ministry of Health and NCDC or your state apparatus. In addition to the well-known advisory, I'm recommending that all families be aware that the elderly among them are the most vulnerable and should be specially protected from needless contact with children and persons who could be positive for the coronavirus infection. The same should be said for all persons who are known to have underlying diseases such as tuberculosis, HIV, cancer. These people are particularly vulnerable and they form the largest segment of the fatalities. The NCDC hotline is active around the clock. It is toll-free, meaning that you can call at no cost to yourself. Various other states have also set up their own hotlines that you can call for direct state-specific questions. We are working on increasing the call capacity and especially on improving the connection of 112 to the NCDC number. We urge citizens to use these channels for legitimate reporting and inquiries and not for fun. And I urge all Nigerians to obey directives issued by the federal and state government and adhere strictly to the social distancing measures. Together, I believe that we can beat COVID-19. Thank you.
Thank you, Honorable Minister of Health. Colleagues, we have now come to the question and answer session. This is how we'll proceed. First, let me let you know that we have the Minister of Information on seat, Minister of Humanitarian Affairs, Disaster Management and Social Development is on seat, Minister of Foreign Affairs, Minister of Interior, Minister of Environment, as well as the Permanent Secretary, Ministry of Aviation, representing the Minister of Aviation. They are all on seat. In addition, we have the benefit of having the National Coordinator of the task force, Dr. Sani Aliu. He will be able to answer your questions, as well as the WHO representative, Dr. Fiona Braka. You may now indicate that you want to ask any of these eminent personalities questions. You will please, Minister of State Health is also on set. You will please approach, after you have been cleared to come, you approach this microphone. In your own interest, don't touch the microphone for your safety and the safety of others. Just ask your questions and direct it straight to the sector you want to pose the question to. The ministers will take note of the questions, and after we've had a basket of questions, they will take turns to answer. Yes, please. You will tell us your name, the medium you represent, and then you go to your question. Thank you.
Good afternoon, sirs. My name is Juliana Taiwo Baloyen. I write for the Sun newspaper. So my question is on people congregating, more than 50 people congregating at the same time. We have a situation right now. I mean, Delta State is on lockdown. People are stranded on the road. How are you going to evacuate those people? And right now, Nyanya Maraba Road is blocked, and I hear your officials are checking people manually. How possible is that? And we have till 11 p.m. for people to get the essentials.
Before you take the question, pose the question, please just raise your hand. We'll take the numbers. You come in that order. Okay. Then number 2, number 3, number 4, number 5. Any other persons? Okay.
Good afternoon, sir. My name is Friday. I'm a reporter with Channels TV. I will be grateful if the SGF can actually provide answer to my question. The first question has to do with the lockdown. Started from 11 p.m. tonight, especially residents in Abuja, Lagos, and a few other states that were mentioned who may not be able to go out to get whatever they want. Of course, it's a laudable idea, since that is the only way we can actually control the spread for now. But my question is, how exactly is the government going to implement that cushioning? How is it going to cushion the effects, especially on those who are not on the payroll of the government or on any payroll at all? Talking about the artisans who live daily on what they earn. What are we actually going to do? Because if you listen to what is happening on the social media, some are saying the government is going to distribute cash, others are saying government is going to distribute food. So we'd like to hear from you the approach that the government is actually going to take. And the second one has to do with the donations that have come in the last few days. I'll be happy if I can get the exact amount that have been donated by well-meaning Nigerians and the priority areas that the government want to expend this money. Are we expecting more testing and treatment centers from those donations made? Thank you.
Number 3.
Good afternoon, everyone. My name is Amaka Ode. I report for Arise News. My question is actually directed to the Minister of Health. Yes, the COVID-19, we have been told it is not a death sentence. But recently I noticed from the picture that usually would be posted in terms of giving us the number of those who have been confirmed to have the coronavirus, there usually is a portion for those who have recovered. And in a few days, we haven't seen that. And this has raised a lot of questions, and people need reassurance in, knowing that that is a glimmer of hope that we have, knowing that people who are confirmed, eventually some can recover from it. So why are we not getting the correct number of those recovered? Because you just said only 3, and I know that there's a statement by the Commissioner for Health in Lagos who said about 5 people were discharged today. So I need your clarification on that. And also I need clarification on who deserves to get tested? Because yes, we have been told those who return back into the country within a period of time and starts to show symptoms. But some people on social media as well, and even they speak to some of us as reporters because they believe we have your ears, to find out, even though they have some symptoms, they make some phone calls, they are told to stay at home until, they show other signs and all that. Whereas some prominent Nigerians, even though we know that they've not been out of the country, case I'm looking at now, the Emir of Kano, the dethroned Emir of Kano, he got a test done, and we know he's not left the country in recent times. So who really deserves to get tested, and what do you need to see before a test is carried out on you? Thank you.
Number 4.
Afternoon, sirs. My name is Mitaire Ikben of the Nigerian Television Authority. What is the plan to have more testing centers spread across the populace? And should Nigerians approach the testing centers at will, or they should wait till they experience symptoms of COVID-19? Again, is there a daily, for the lockdown, is there a daily limit for the lockdown? Because some Nigerians are capitalizing on some of the directives given by some of the state governments, like Niger, for example, which has 8 a.m. to 8 p.m. So for the states that have been identified, that is the Federal Capital Territory, Lagos, and Ogun State, is there a daily limit for the lockdown, or is 24 hours? Thank you.
Number 6. Number 5.
Good day, sirs. My name is Femi Akonde. I'm a reporter with TVC News. The Honorable Minister of Health, sir, at the last Nigerian Governors Forum meeting, the state governors asked if, what it would take to have isolation centers and test centers and laboratories set up in their states, and they believe this would reduce the burden on the federal government and indeed the presidential task force. How are you trying to co-opt state governments into this fight to slow down the spread of the coronavirus? And again, the SSD just said that we can have ministers come for media appearances, but it's really a difficult task. With due respect, some of the ministers are inaccessible, and sometimes the aides to the ministers make it really difficult for media organizations to have access to you and bring you on our station to at least let Nigerians know what government effort is. How would you make this easier for us? Thank you, sirs.
Number 6.
Good afternoon, honorable ministers. Rachel from News Agency of Nigeria. My question is to the Minister of Health. I wish the NCDC DG is around. Now we are looking at 13 testing centers in Nigeria, but we are yet to find out how many technicians we have in Nigeria that can operate the PCR, because we're made to understand that to scale the PCR is actually difficult. So let's know how many technicians we have and why we have more testing centers. Thank you very much.
Do we have any more questions from our colleagues? Okay, we will now proceed to the answer session, beginning with the SGF.
Social distancing.
Yes, sir.
Well, let me attempt an answer to the issue of how government is going to deal with the effect of the lockdown on the 2 states and the Federal Capital Territory. If you heard Mr. President's address yesterday, he dwelt heavily on that, on the palliatives that are going to be put in place as to our response. And in my address this afternoon, I mentioned the fact that he has even today constituted an economic sustainability committee that will look at the variables and the kind of things that we can do as a government to soften the effect of the total lockdown, particularly for now on Lagos, Ogun, and the Federal Capital Territory. I believe by the time I would cede the floor to the Honorable Minister for Humanitarian Affairs, Disaster Management and Social Development, she will give you a rundown of some of the palliatives that are being put in place in terms of the conditional cash to the poor of the poorest, in terms of the school feeding program. In spite of the fact that schools have closed, the President has directed that the implementation of that program be sustained. So you can see that so many things are being put in place. And I believe that by the time the committee that is being chaired by His Excellency the Vice President come on stream, they will roll out other palliatives. We are just starting. We are not very sure how long this will last. That's the truth about it. The countries that first got the affliction of coronavirus are still battling to come out of it. I believe with sustained effort and by the sheer determination, spirited determination of Nigerians, we would overcome these challenges. But I can rest assure you that packages will be rolled out. Like I said, the Honorable Minister for Humanitarian Affairs will give more details in respect of that. The other question has to do with conflict of policies. Somebody mentioned the fact that other states had locked down even before the federal government took its decision. If you read paragraph 29 of Mr. President's statement, said that this current challenge will be guided and be directed, and it will be systematic, it will be consistent, and it will take into consideration any consistency between federal government policies and state policies would be eliminated. It was very categorical. That's the context of paragraph 29 of his speech yesterday. So that means that we are doing everything to ensure that there is uniformity of policies, particularly when it comes to movement on federal highways and other jurisdictions and territories that we might cross. The other question talks about time limit. It's a total lockdown, except for essential services, except you are going to access specific needs like medical needs, except you're going out to buy food. All those things were categorized in Mr. President's speech. So it's a comprehensive speech. I would urge all of you to get a copy of it and read through it, because we depend on you to broadcast the content of this speech to Nigerians so that they will know exactly where we stand in this matter. It's a national challenge, and we have to do everything within our powers and with the resolve and commitment and support of Nigerians to deal with the graph. I could see the expression of surprise on your faces when the Honorable Minister for Health said, today our record shows confirmation of those infected to be 111. It means that the graph is rising, and we need to do something drastic so that we can flatten that graph. If it continues to rise in that, very soon we'll begin to count much more bigger figures than what we are counting now. So my appeal to all of us, using you as the instrument, is to appeal to Nigerians that nothing would happen to us if we lock down for these 2 weeks and allow for the tracking of those that have been in contact with those infected, so that we do not transmit to community transmission. Thank you. Honorable Minister. Oh, okay. I thought she would finish up with my part of the question about what government is doing.
Thank you very much, Mr. Chair, distinguished ladies and gentlemen. Let me be specific on the task given by Mr. President to our ministry. Mr. President, in his speech, mentioned the provision of relief materials to residents of satellite communities. And in paragraph 49 of that speech, Mr. President said that residents of satellite and commuter towns and communities around Lagos and Abuja, whose livelihoods will surely be affected by these restrictive measures, we shall deploy relief materials to ease their pains in the coming weeks. And to achieve this, we must really identify and reach the targets of such communities and residents using available data at our disposal. This we have started doing. NEMA has deployed all the trucks. They are on site, and before the end of today, these trucks will be deployed to these affected states, Lagos, Ogun, and Abuja. On the issue of the school feeding program, Mr. President mentioned in his speech, paragraph 50 of that speech, he directed that our ministry works with the relevant state governments in developing a strategy on how to sustain the school feeding program. This we'll be doing, and I've already started contacting the governors on agreeing on the modalities to adopt, and I have accordingly contacted the program heads of this program, and this particular tax may really may have to go beyond the affected states, because as we are aware, all schools are closed down and children are at home. So we are looking at these modalities to see how we extend this directive to even the states where the lockdown has not affected. Mr. President, also in his speech of paragraph 51, has directed that a 3-month repayment moratorium for all trader money, market money, and farmer money loans be implemented with immediate effect. This, we have also carried out that directive. We have met with the officials that are handling this program under the ministry, and we have directed that they implement this immediately. In Mr. President's speech on paragraph 54, he has also directed that the conditional cash transfers be given in advance of 2 months. This we have also called the program heads, and we have directed that we start immediate payment of this cash transfer to the most poorest and vulnerable households in our country. Let me also reiterate here that because of this COVID-19, the vulnerable groups have to be expanded, because we are aware that we have people who live on daily wage. And so we're also going to look at those groups of people to see how we can take this food relief intervention to them in these affected areas. Thank you.
Thank you, your Secretary of Government, honourable ministers. The questions for the Ministry of Health revolve largely around testing and also who is eligible. I need to say that from what we know so far, there are many, up to 80% of people who contract the coronavirus disease either show no symptom or very little mild symptoms. And of the remaining 20%, about 15% can be quite severe, and about 4 or 5% is critical. Now, you'll be discharged from treatment if you look well and you test negative 2 times. And until it's proven that you don't have any more of the virus in your system. That usually takes anything from 3 to 4 weeks or a bit longer. If you are tested and it's negative, after 24 hours or past 48 hours, you are tested again, you are negative, then you are good to go. So anybody who meets that criteria, the criteria will now be declared free and can go home. As to who is tested, first, it is important to know that this is an imported pathogen. It's not indigenous. So it was brought from outside the country. Therefore, in order for you to contract coronavirus, you have to have been abroad, or you have been in close contact with someone who was abroad and brought it. So if you never had a contact like that, and you also haven't been abroad, it's very unlikely that you are a coronavirus victim or patient. But because it's coronavirus disease is in every mouth, there are people who, once they feel feverish or they don't feel quite well, they think it's corona and they want to be tested. So the NCDC tries to discourage people like that. It's not something you acquire like malaria or yellow fever. You have to have meet these criteria. Now, the NCDC at a point had to economize seriously with the test kit. So you don't want to waste it. In fact, at the very beginning, our plan was to send specimens to South Africa because we didn't have the reagents yet. So when we got the first reagents, that's where we could actually test here. In the meantime, we have 6 laboratories, but we're still very careful with the reagents because they are not everywhere available. So we don't want to waste any of them. So you have to meet certain criteria, among which are that you actually have something that looks like symptoms. If you didn't have any symptoms, no, you wouldn't be eligible to test. But again, now it has been expanded to say, well, if you think you have actually been in close contact with someone who was abroad, or you yourself, you were abroad and you don't feel well, well, maybe even if the symptoms are not convincing, you will still be tested. So it's a little bit expanded to accommodate any errors that might arise, or to also put certain people's minds at rest. Now, the other questions about testing centers, since last week, we added Ibadan, UCH Ibadan to the list, and I already read out the 7 others that are coming on list within the next week or 2. We have the capacity to convert some of the machines that we use for testing TB. Those are the gene expert machines. We have the capacity to also convert them to be able to test the coronavirus. The machine is there, but if you do not convert it and you do not have the reagent, you don't have anything to recognize the virus, then the test is not possible. But if we can conclude the conversion of these machines, of which we have about 300, then we have more than enough testing centers in the country. But that will not take place for at least 1 month or 1.5 months, because the protocol for converting it is not something that is that simple. But what we have also done, again, because it's not that every city or every state or every local government must have a machine like that. What we have done is to create a very good courier service. So it's possible to obtain the samples from various areas and they use a courier service to send them to a laboratory. In fact, many countries do that in order to utilize the laboratory properly. If you have a laboratory that's capable of testing 200 cases and you're only feeding it 10 or 20, that's underutilization. But if you're able to collect all samples from many areas and use one machine, then you are utilizing it properly. So we do not want a situation where you have machines that are idle, but also have enough to go to conduct the test. As for isolation centers, we have been speaking with governors, state governors. I had the privilege of joining in a teleconference with governors yesterday, and we discussed the issue of seeding out of coronavirus from the main hubs to the states, and also the isolation centers. We have urged every state to have an isolation center. Many of them have isolation centers for other diseases, for TB and so on. But for this particular pathogen, yes, they are trying to use every means to get isolation centers. Even if it's a hotel, you can rent a hotel that, in fact, those ones are very good because we have single rooms, self-contained rooms where each person can stay in their room and have the little creature comforts that they are used to at home. You have your entertainment, and you can last the 14 days observation that is required. Mild up to moderate cases can be even treated in those areas, but we have also said that every treatment center, every isolation center, whether at the federal or state level, has to be accredited. It must be accredited as fit to handle treatment of a disease that can be so terribly infectious, because there's high risk not only to other people who are around there, but even to the staff who are doing the treatment. As you know, in Europe, many people who are helping to treat coronavirus have themselves become infected. So you must know that you have people there who have been taught the protocol for treating coronavirus disease and have learnt it, and they are well supervised, and the facility is properly inspected and accredited by a team. We have put a team together under the Professor Abayomi in Lagos, who will accredit every center that wants to handle coronavirus. And even if you have started, you'll be visited and you'll be told to correct errors if there are any errors in your treatment arrangement.